Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, and the feature presentation is Does coffee raise your blood pressure? This is a major concern, especially if you are having history of especially if you're having history of hypertension. So let's dive deep into this topic. When it comes to coffee, now everybody seems to be fascinated by coffee. There are a whole misery of choices of what kind of coffee you want to drink, be it just black coffee with milk or cappuccino or espresso or high concentrated coffee or any other type of coffee. The bottom line is the caffeine content. It is the caffeine content that is going to have significant effect on your overall body, heart, mind, and vascular system. It is the caffeine effect that has short term and long term effects that can profoundly impact the way we perform and the way our body responds to caffeine. So it doesn't matter what type of coffee you choose, it is the caffeine content that's going to determine your outcomes. Let's look at it. Not all coffees are created equal. As you can see, a drip coffee has 165 milligrams of caffeine compared to a green tea which has only 25 milligrams of caffeine. So there's a tremendous disparity in the caffeine content of various drinks, be it coffee, tea, or even some soft drinks, which I'm going to talk about in a minute. But the main thing is the average amount of caffeine is supposed to be 60 to 80 milligrams per 8-ounce drink. Anything that goes beyond 100 milligrams is a concern to you, your heart, your blood pressure, and your mental status. So just take a look at this and see where does your caffeine level lie. But that's just the beginning or the tip of the iceberg, because we are just talking about the amount of caffeine in one drink. And if you're drinking 2, 4, or 6 drinks, then you multiply that, then you may be approaching close to 1,000 milligrams of caffeine per day. That means you're going to be glowing with caffeine and all its side effects. That's not something you want to do. And I have seen people carrying 30 to 64 ounces of soft drinks which has caffeine, or coffee or tea products which has caffeine, and they're drinking all day long, and they're wondering why they are anxious, jitter, nervous, and having all kinds of crazy symptoms. Caffeine has certain benefits and caffeine has certain side effects. So let us focus on some of these issues. Caffeine increases attention and alertness, decreases fatigue. And this is especially true if you're on a long distance driving. You've been driving for 4 to 5 hours, you're tired, you're sleepy, and you're groggy. And that's the best time to stop, get a nice cup of coffee, take maybe a 5 to 10 minute nap, and then resume your activity. That's one way. It also lowers the risk of cardiovascular disease and diabetes, and it increases metabolism, because basically caffeine stimulates your sympathetic system, which increases the heart rate, which increases the blood pressure, which increases sweating, which increases alertness, which increases anxiety too. So the negative effects of caffeine or anxiety increase constriction of the blood vessels that causes increase in blood pressure, reduce control over fine motor movements. So if you are driving, it could be kind of harmful, because if you can focus on the road clearly and have fine motor movements. And if you drink coffee, as you know, within an hour or so, you'll be getting a call from the restroom to empty your bladder. That is a pretty common phenomenon. All right, so There are health benefits to caffeine, which some of which I already talked to you. It improves physical performance, it improves mental alertness, and it reduces depression. I don't know how it reduces depression unless you may be addicted to caffeine, and if you can't have caffeine, you're going to be depressed. And it prevents gout, can aid in weight loss, but I don't think I would use coffee as a substitute for reducing calories to get weight loss. Can lower the risk of diabetes. That's kind of a overall statement, but I am not sure it does. Reduces the risk of cancer. So these are some of the things that have been taught in the media about the benefits of coffee. However, how does caffeine increase mental alertness? Caffeine, as I said, is a sympathetic stimulant. It increases the blood pressure, it increases circulation to the brain, it increases heart rate. It can also cause palpitations, and it stimulates the nervous system so that you become more alert. You're more conscious of what's happening on the freeway. So hopefully you can avoid highway hypnosis, as they call it. All right, how does caffeine increase your blood pressure? As you know, the blood pressure is dependent upon the stiffness of the arteries through which the blood has to flow. If the arteries are stiff, it takes more pressure for the blood to flow. So basically, caffeine, it constricts the blood vessels. When it constricts the blood vessels, that means it increases the resistance for the blood to flow through. When the resistance is increased, the blood pressure goes up. So the caffeine can increase your blood pressure by causing what is called the vasoconstriction. And this can happen within like 30 minutes or so. And after that, the effect of this caffeine can last for 3 to 4 hours or longer, depending upon the amount of caffeine you have ingested. So if you're going to monitor your blood pressure, you may want to monitor your blood pressure 30 minutes before you take your heavy caffeine dose. Or the best thing would be, if you're having significant problems with your blood pressure, avoid caffeine altogether. I don't know if decaffeinated coffee or tea would help to reduce the blood pressure effect, but nonetheless, it's better than a caffeine loaded drink. I'm going to talk about some of those caffeine loaded drinks. All right, talking about the devil, here is the caffeine loaded drinks. An average coffee, I told you, has 60 to 80 milligrams. That's for 8 ounces. You're not talking about 12-ounce coffee you get in fancy restaurants where you pay $3-4, which you can make for 30 cents in the house. Well, that's business. Let's leave that aside. And here are some monster drink, 320 milligrams of caffeine. And here's another one, cocaine. I don't know, even the name is kind of funky here. 1120 milligrams of caffeine. How about that? 10,000 milligrams of caffeine in freeze. I tell you, if you were to take this one, your whole system is going to freeze with hyperexcitement and confusion, nausea, all kinds of symptoms. So be aware of the effects of high caffeine on your body, cardiovascular system, and your brain also. So be aware of these drinks. These drinks are very popular. They are extremely expensive, but somehow these are very popular with the sports group because they want to get high energy just before they go on to the competitive sports. But at the other end, when the effects come down, then you're going to have a caffeine withdrawal, which can be worse than the benefits that you had when you were having all these high levels of caffeine to begin with. So let's talk about some of the things that we need to be concerned about caffeine overdose. But if you're taking 1,000 milligrams of caffeine per can and you're taking several of those cans in a day, then obviously you fall in the category of a caffeine overdose. So what are some of the effects of caffeine overdose? Just take a look at here. It can cause visual flashes, ringing in the ear, muscle seizures, twitchings, shortness of breath, urinary frequency, which I already talked to you. Caffeine acts like a diuretic. That means it increases urine secretion in the kidneys, and so you will be running to the bathroom if you are loading your system every hour with high dose of caffeine. Central nervous system can lead to irritability, anxiety, and restlessness, confusion, deliriums, sometimes severe headache, insomnia. Insomnia is a huge problem. That's why you should not drink any caffeine containing drinks after 4 or 6 p.m. in the night. And of course, since it activates the sympathetic system, it can lead to palpitations, it can lead to irregular heartbeats, it can lead to high blood pressure, which I talked to you about. Because of increased gastric motility, it can cause abdominal cramps, nausea, and sometimes vomiting. So, here is a study which showed, looking at a meta-analysis of so many different studies to see how much blood pressure does caffeine rise. And as you can see, there was an average about 5 millimeters of systolic blood pressure rise with caffeine, and approximately 2 to 4 millimeters of diastolic blood pressure rise with caffeine. But this, you are talking about average doses of caffeine, 100 to 200 milligrams of caffeine. But if you are one of those addicts who are taking 600, 800, or 1000 milligrams of caffeine per day, these numbers can be quite significantly higher. And here is a study showing that depending upon the number of cups of coffee you consume on a daily basis, the change in systolic blood pressure is proportional. Supposing you're taking only 3 cups of coffee, your blood pressure may be normal, but if you're taking 6 cups of coffee, your blood pressure may be approaching close to like an increase in systolic blood pressure and also diastolic blood pressure, as I showed you in the previous way. Again, the response of the blood pressure is highly variant from one person to another, especially if you are hypertensive or you have a history of high blood pressure, you're on medications. The chances are your blood pressure will go up much higher compared to a person with a normal blood pressure to begin with. The FDA says the maximum you should have caffeine would be like 400 milligrams per day. Keep it 200 milligrams if you have a history of high blood pressure. That means no more than 2 cups of 8-ounce coffee drink per day, and maybe preferably choose a decaffeinated coffee to start with, or maybe switch to some herbal teas which have very, very low caffeine content. So the take home message here is if you are a coffee addict, or if you someone like me who likes to enjoy a cup of coffee in the morning, then keep your intake to 1 to 2 cups per day. I'm talking 8 ounces. I'm not talking about 12, 16, 32 ounces. And these are like medium cups. Avoid drinking caffeine after 4 p.m. because that's going to interfere with your sleep. And when you cannot sleep, you get restless, you get anxious. That increases your blood pressure. And because you can't sleep, next day you're going to be having headache, you'll be groggy, and you will be irritable, and you won't be able to perform your work properly. So keep that in mind. And select a caffeine drink that has the lowest amount of caffeine. So ladies and gentlemen, the overall message here is coffee is okay as long as we do that in moderation. So ladies and gentlemen, this is a quick overview of caffeine, its effects, the symptoms of overdose, and what is the ideal coffee recommendation so that you can enjoy the coffee at the same time minimize cardiovascular symptoms. Thank you so much for watching this presentation. I am Dr. Nik Nikam, and please do subscribe to our YouTube channel, and I will see you in the next video.